Integrating water use in various birth settings. As an introduction, integrating water use in home, birth center, or hospital settings require attention to safety, legal standards, and provider training. Its global rise due to the benefits like pain relief, fewer interventions, and greater birth satisfactions are allowing it to be implemented, but there's such variations of resources, regulations, and attitudes towards water. In the home setting, it is a great option and it is kind of the hallmark, especially in the United States, of where water birth is typically implemented. There's usually rare do moms have tubs that are deep enough and the right type of tubs. The standard tub is 16 to 18 inches deep, and a standard water birthing tub is at least 22 to 24 inches deep. That's where you get the pain relief from, is the buoyancy and the easily being able to move. When she's got a good chunk of her belly outside of the water and the risk of the baby partially coming out of the water, you need to have the deep oval, square, circular tubs. And traditionally in a home setting, you're going to use the inflatable tubs. And depending on if it's used one time or multiple times, it may have a liner with it. Risk assessment, the midwives still have to be able to access and help support. So usually you put it in the corner in the center of a room so that if there's an emergency and delivery, the midwife can easily access the um, you definitely want informed consent. You want to talk education, like what size water heater do they have? What room are they planning on putting it in? I've made this mistake where we've done it in a basement and the pump didn't work. And so then we're taking buckets and having to empty it because we can't do it by gravity outside. So you have to kind of think about emergency safety, home. Where are you going to have the tub? Where are they planning on birthing? What's the risk benefits? And that the family is same page. Freestanding birth centers, it's definitely a hallmark of out-of-hospital births to do water births. Um, there's a lot of different tubs that are available, and so you want to make sure that the staff is trained and that it's a home away from home infection because you got a high volume of people using that tub versus in a home setting, they're typically just using that tub for themselves. The facility design layout, are the tubs in the bathroom? Are the tubs inflatable? Are they in a corner installed? Are they able to access at two sides, three sides? How is the staff trained? Safety, temperature, calm environment. These are all important things. When you have a birth center, you have to know the CABC standards and the state local birth center regulations so that your facility is meeting those, your emergency protocols, transfer, setup, skills and drills. Whether you do water births or not, it's a consistent standard here. In the hospital setting, they have a lot more challenges for implementing water births. Not so much water use during labor, but water births. There's a lot more influence of ACOG in the pediatric organizations, a lot more risk management, a lot more fear, a lot more hurdles to get through. So there's very few hospitals in the United States that are offering birth. You got to get institutional buy-in. The midwives, the nurses, the patients really want it, but it tends to be the obstetricians, the family practice physicians, and the pediatricians, and even anesthesia have a lot of safety perception fears that need to be addressed and overcome. Staff training, very few hospitals and very few hospital-based staff have done water births, so you have a huge learning curve for implementing safe water birth. You want to look at the unit, the layout, the tubs they have available, what's realistic, what are the policies they're going to do for who can use it, who's not a good candidate, what does your water birth consent look like? There's huge demands, no matter which setting you're at, hospitals in particular. The hospitals that do water births are getting really, really busy compared to the hospitals that aren't promoting physiological birth. The emergency protocols, transfers, usually low-risk community facilities will have transfer protocols of who they can take if it's after 37 to 42 weeks They're pretty standard whether you're going to choose to do water births or not at a community hospital, who they have to transfer, whose emergency protocols. But it's the same in all settings, whether you have a shoulder dystocia, postpartum hemorrhage, a complication during labor in the water, all settings should have the same intervention protocols and then transfer to a higher acuity center if the patient becomes at risk. So there's huge global and cultural differences. You want to really look at the local community's cultural norms and standards. Some countries fully support it, while others show massive skepticism and impose legal limits. So, for example, in the UK, water births are widely used. In New Zealand and Netherlands, they're also widely supported and part of the national protocols. The US, water births are less common in the hospitals due to liability concerns, but it's a huge portion of birth center and home births are water births. So in developing regions, water birth access is limited by the equipment availability, provider training shortages, and regulatory changes. Integrating water use in birth requires evidence-based protocols, training the providers, and clear communication. When managed well, water birth is a safe, satisfying option for low-risk pregnancies in all of these settings, but the success depends on patient-centered, evidence-driven approach that supports autonomy, comfort, and